morning, ladies and gentlemen. You know, a year ago, if you recall, as I stood in the State House, I announced I had a diagnosis of cancer. And yet I knew that as I met with my doctors at the hospital, they said, you're going to need surgery, you're going to need chemotherapy, you're going to need radiation. And guess what? They immediately had a room for surgery. They immediately took care of me with the chemotherapy, 7 weeks of it in a row. Radiation was 5 days a week for 7 weeks. They had the facilities for me. They also came with a lot of prescription drugs, Oxycontin, fentanyl. They could very easily have led to an addiction. Had they led to an addiction, and I reached out for help for a bed, for an addiction problem I might have, what would be available to me? In Ohio, very little, if anything at all. And that's our problem. You know, when we read about these stories, we're all familiar with them. This isn't about Democrats or Republicans. You read the articles in the newspaper or watch it on TV, it never says a Republican died today or a Democrat died today, but it says the families were devastated. And these are our families. Your families, my families, everyone's families. People young, old, rich or poor. I represent 28 cities and such a diverse Senate district. I got some of the richest communities and some of the poorest. And yet we share one thing in common, that the opiate epidemic is hitting each and every one of us. And we've got to make it stop. Now, I know for a fact that the governor, because he addressed it in his latest State of the State address, he knows we have a problem. We know that the House understands because they addressed it in their House version of the budget. And they did a nice job. They added $170 million in help. It's a good start, ladies and gentlemen. That's all it is. What this bill, it does, is creates an opportunity for all of us to address the most serious problem, change lives, save families, and protect Ohio from continuing to lead the nation in opiate deaths. Something we should not be proud of, something we should not be talking about. Not in this state, not with these people, not with these funds. Now people are going to say, well, the governor's made it perfectly clear. He does not want us to use these monies. This is the rainy day fund, folks. And as I pointed out this morning, it's raining here right now. And this money will be regenerated. It's not that it's going to go away. We'll never reach that plateau that we're at right now if we don't spend some money. This money has to be spent, and it has to be spent now. Because if we don't, we're going to continue to read about these young families that are being devastated by a crisis that we do have the ability to do something about, and that's what this bill attempts to address. Thank you very much.
And if there are questions, we'd be happy to answer them. And if you want to direct them to individuals or just to all of us, go ahead and shoot.
Senator, you want to put $100 million back into the government fund, which has been cut in previous budgets from the governor. Do you think we'd be in the situation we are in right now if that money had never left the local government fund?
I mean, I'm not an expert in it to say that I have numbers that would show if you spent X amount of dollars, it would have created, a better outcome in certain situations, and to what extent. But if you give people an opportunity to help the people in need and provide them with resources in order to do so, that's what the experts are saying is lacking. We need beds. We need wraparound service care. We need to be able to have dollars to educate our children. We need to be able to give police and first responders the tools on the ground to deal with the problems. As I travel to some of these rural counties, it's devastating because they don't have enough police force to deal with the problems on the ground as it is. And then when you throw the heroin problem on top of it, that's what they're dedicating almost 100% of their time to do, to deal with that. So we're giving these dollars in a way to the communities in order to deal with it the way that they need to deal with it, not the way the politicians in Columbus say that they should deal with it. I have a breakdown that we can get to all of you showing the actual amount of dollars that would be dedicated to each specific county based on the LFC feedback that we got. And I think that that's really telling because it'll show you where those dollars would go, and then the communities can make those decisions based on the experts they have in those communities.
Senator, if we can add something. If we added money to the local government funds by this amount, will that money be spent on this crisis? Probably not, because the demands are so great for all of our communities. But this money specifically addresses where it's going to go, how it's going to go, and why it needs to be there. And that's the difference.
So it's really using the local government fund as a kind of formula to
Correct, to these 6 places, to the ABA, MSH boards, the law enforcement, child protection services, kinship care, first responders, and establishing drug courts. And I think that told us, like, we didn't just come up with this bill yesterday, we've been working on this for 3 or 4 months, and having the staff really dig in and talk to people like Ruth about how we need to do this, not just firing $100 million to local governments and telling them to figure it out, but really working through it and trying to get the experts' feedback on this.
And you know, we've been talking about this for a long time in our communities. We've got judges, we've got prosecutors, we've got doctors and nurses and social workers and families that have been directly impacted by this. But talking is not getting the job done. We have to put some money behind it. We need to put the teeth behind the cure, and we have that opportunity to do so here.
Have you communicated with your Republican colleagues about this? How are they in terms of dealing with this?
Well, we sent around a co-sponsor request. I've talked to President Althoff about this in the past. And if you remember, this is kind of in the weeds stuff, but if you remember the last time we tried to do this, we got an amendment for a very small amount of $2 million in the Senate in order to deal with this, based on trying to go after the same areas of funding problems that we have in this bill. And that was $2 million, and the Senate said okay, but then the House stripped it out. So, you know, somebody in leadership over there didn't like that idea, and so that is my concern, that I just don't want the House to say, well, we fixed the problem, we don't have to have a conversation about this based on their $170 million fix in the House budget. Hopefully we can have a conversation. You know, as Leader Yuko said, and as Ruth mentioned, this isn't a political thing. I mean, you go around and you talk to people, these are families that are your next door neighbors and your family members. And I'll tell you that, you know, as a workers' comp lawyer, I saw a lot of people that were hardworking people that got prescribed medication after rotator cuff tear or a knee replacement, and all of a sudden I would see them deteriorate year after year after year, and then they didn't show up in my office anymore, and they became addicted to heroin. They took the drugs exactly like the doctor told them to. And so it's not just a bunch of, you know, people that made some very poor decisions in their life. You know, we're also talking about a lot of kids that are my brother's friends that decided to make a bad decision one night at a party and take an Oxycontin that a friend gave them, never envisioning that they were going to go down this road. And so we have to help these people. As human beings, we need to have pathways for them to get back on track. And I think through the ways that we've explained in the bill, we can provide that, at least a good start.